a bigger room because I know there's a lot of people outside. Before we start the serious stuff, I should say that we weren't anticipating kind of theatre in the round. So we've just been debating our strategy, our technique. And some people are going to sit down, some people might spin round, and some people are going to stand up. Some of us have slides, which you may not be able to see very well, but we're going to kind of use them as an aid memoir to what we're saying. So just to set the scene very briefly, I think we are at an inflection point in human history, not just because we're seeing unprecedented environmental degradation on our planet. The climate is changing at an unprecedented rate. We're seeing, of course, the 6th mass extinction. 7 of the 9 planetary boundaries have been transgressed. But we're also seeing a rise in conflict. And we can debate the extent to which the two phenomena are directly or indirectly connected. And we'll be exploring some of those links in this session. But I think what's very clear is we are faced with many unprecedented hazards all coming together. And so we need to think really systemically about how to tackle those, because they're amplifying, these hazards are amplifying the effects of each other. And we'll come back to that in our discussion. Perhaps just one final thought is that the Bulletin of the Atomic Scientists, you remember that has a clock. And that clock is the number of minutes to midnight. And that is an assessment of how close we are to nuclear war. And that hand is closer than it's ever been historically to midnight. So it is really a wake-up call, I think, for us all. How do we tackle the scourge of militarism, generally, and the scourge of the proliferation of weapons of mass destruction? Of course, there has been some decrease in the total number of nuclear weapons, but many people would argue that the risks of nuclear war are at an unprecedented level, and we'll hear more from Carlos about that. So, without further ado, let me introduce the first of our speakers, Nita Crawford. She's the Montague Burton Chair in International Relations of the University of Oxford in the UK, and she's going to talk about the environmental, financial, and opportunity costs of preparing and engaging in armed conflict. Thank you, Nita.
Right. Well, it's a pleasure to be here, and just a slight update to my vita. I've absconded from Oxford. I've left.
Congratulations.
I've taken myself to a happier place where I can focus more on what I want to work on. The University of St. Andrews, I'll start there in January. Right now, what I'm doing is trying to finish a book on nuclear winter. All right, so I have several key arguments that I want to make. The first is that military spending is a key indicator of our conflict situation, and we can use it as an indicator and sort of a gauge of conflict, as well as the beliefs that we have about conflict, and then we can think about military spending as a sort of a bellwether, a cause in some ways. The second point is that key beliefs keep us on this upward spiral of military spending. And the third point, which I'm not going to spend a lot of time on, is about nuclear weapons and the dangers of the linkage between nuclear weapons and conventional forces, but you're going to talk more about nuclear weapons, so I'm not going to dwell a lot on that. And then I want to talk finally about some off-ramps. The key argument there is there are off-ramps. Okay, so the first thing about military spending, it's a thermometer. We can use it to measure sort of the tension in the world. It's an indicator also of the level of domestic support for military spending and militarization in general. And when it is allocated well, there's public discourse and deliberation. When it's allocated, that is, Congresses or legislatures decide to spend more, they can do so with more or less insight. And the public can have more or less information. So there's an element of secrecy that can sometimes rise along with military spending, a concentration of power. And that's a danger to democracy. So I also want to argue that military spending is a response to felt insecurity, but it is itself a driver of insecurity. Okay, so it drives others to match your military spending, in a sort of action-reaction phenomenon, and it can drive what's known as a security dilemma. And a security dilemma is where what I do to defend myself, including increasing military spending, actually causes you to feel less secure. So my desire for security makes you feel less secure. You may then increase your military spending, your operations, your procurement tempo, and so on. So what I want to then suggest is that if we look at military spending for the last 30, 40 years, we see some interesting things. Military spending waxes and wanes, as I said, like a thermometer with this sort of level of tension. So with the end of the Cold War, military spending went down a little bit. Not as much as it could have, but it went down. And so did the size of some major arsenals. Like the United States had 2,000 overseas military bases at the height of the Cold War. And then it reduced to about 1,000 overseas military bases, and now it's down to about 800 or so. Another thing, though, to keep in mind is that when tensions go up, military spending goes up, and sometimes it doesn't come down. So in constant US dollars, in 2023 dollars, global military spending in 1988 was about $1.5 trillion. In 1996, with the end of the Cold War, it went down to about $1.25 trillion. In 2024, global military spending is at $2.7 trillion, okay? That is an increase of 37% from 2015 to 2025, a 37% increase in the last decade, global military spending. In just the last year, military spending went up nearly 10%. So we're on this uptick in military spending. That's important to understand. Now, the consequences of military spending, I want to get into a little bit, but I want to emphasize how much it is that the United States actually drives military spending. You can see I'm not from England or Scotland. I'm from Milwaukee. And in Milwaukee, we have a couple of colorful phrases, which I won't use, to describe the way the U.S. drives military spending. So it's the largest spender in the world on the military, and it has the largest military industrial base. And even though U.S. spending dipped at the end of the Cold War, and then following the 9/11 attacks increased dramatically, sort of peaked around 2010, 2011, and then went down for a couple of years, and then went back up again. Now, so it's going back up at the same time the United States is withdrawing from Afghanistan and Iraq. As you recall, the forces were getting smaller, except for a little period of bombarding Syria and Iraq, 2014 to 2016. There was a lot less military activity, but U.S. military spending went up in real terms. Why is that? Let's get into that in the Q&A. Why is it that you're doing less, but it's costing more? We can do that later. But what we have to understand right now is how U.S. military spending, which is 37% of all world spending, drives the other countries to increase their spending, increase their mobilization. So it's around $997 billion right now, and this year, okay, or last year rather. It's about $1 trillion. Okay, that is, as I said, 37% of total global military spending. China and Russia combined spend half that. Right? So in other words, the U.S. spends twice as much as its two major rivals in this 1 year. Okay. The U.S. is also the world's largest arms exporter. It has about 43% of the world's market share. So that's why it can send 14,000, 2,000-pound bombs to Gaza without, to Israel for use in Gaza, I should say, without blinking an eye. Right? That's a lot of weapons. Any other country wouldn't necessarily be able to produce those as rapidly. Okay, so U.S. military spending also increases the spending of its allies. We're sitting in Germany, which has increased its military spending dramatically because, in part, for years, the United States said NATO has to do more. Well, NATO's doing more. The Germans have increased their military spending from 2015 to 2025 by 89%. It is now the number 4 military spender. So that's the US, China, Russia, Germany. And guess who else? The rest of NATO is well represented with the UK and France as number 6 and number 9. Each of those two countries have increased their military spending more than 20%. Okay, so as I said, military spending can drive an action-reaction phenomenon. And it has certain other pernicious consequences, which I want to get into. First, it is an opportunity cost. The major opportunity cost is money, but it's also brains and resources, material resources. And the money is sort of essentially driven away from social welfare, but it's also distorting, in a sense. You've heard of spin-offs where a military invention or a space age invention like Tang can sort of change your life, or the internet, right? You're too young for Tang, okay? The internet is a spin-off, supposedly, right? It comes from CERN and the US DoD. Okay, but you could get something much more efficient if you spent that money directly. Okay, the second thing I've already mentioned, and a second pernicious consequence, is the concentration of power and authority in states which are highly militarized and mobilized, increasing secrecy, deference to the executive, hypermasculine norms grow, and there's less willingness to follow the rule of law. Third major point is there are huge environmental consequences for lots of military spending, the most important of which may be increased greenhouse gases, right? So 42 million metric tons annually, the United States is one of the United States military is the largest single emitter of greenhouse gases. If it were a country, it would be well placed, around 50 as an emitter. It's the United States government's single largest emitter. Altogether, military emissions may be about 5.5%, according to some estimates, of all greenhouse gas emissions. So that's like the entire air sector by itself. It would make it one of the largest countries in the world in terms of emissions if all military and military industry were added together. Okay, so increasing temperatures, yet the military will tell you that climate change is a threat multiplier. Climate change is going to come to a neighborhood near you and bring war with it, okay? Conflict with it as we fight over what's left, okay? But what I'm suggesting by telling you how much military emissions actually affect the climate is that climate change is driven by war. There's a cycle here. It doesn't have to be that we see increasing military emissions, but that's where we're headed. Okay. Okay, now, where is there a way out? The first way out is to recognize the key beliefs that drive this whole system. The first is the answer to fear and security, which drives arms races and military spending, is more war, more aggressive action, more military spending. That's the first belief, more bellicose rhetoric. The second is that you're offensive. You have to have doctrines which are offensive and not defensive in nature, right? The military doctrine should be one that frightens the other. That's the idea with deterrence, right? You promise an incredibly hard response and then to an aggression, and then the other guy's supposed to be so afraid that they do not take action. They're to be deterred. Well, the problem is deterrence doesn't necessarily work. In fact, it doesn't usually work. We see that Israel's 50 nuclear weapons did not prevent Hamas's attack on the 7th of October 2023. Often, the idea of deterrence is not matched by the reality. Another key belief is that you can protect access to things you want, like oil or natural gas or rare earth metals, by having military forces in place. And then I won't get to say anything about nuclear weapons, but I will finally wrap up with some off-ramps. There are some, and I'll get to those in the Q&A if you ask me about them.
Well, thanks, Nita, for getting us off to such a great start and also leaving us some points that need to be discussed in more detail in the Q&A. It's now a great pleasure to move on to our second speaker, Sarah Badri. She is Co-Executive Director of the Global Alliance on War, Conflict and Health, and she's based in Mozambique.
Thank you. I don't know, is my voice loud enough for me not to use a microphone?
No, you need to.
Because I don't want to.
No, you need to use.
I have to use a microphone?
Because it's online.
Yeah, okay. Yes, thank you. Okay. So I don't know if I'm going to be sitting down or standing up. I'm just going to play it by ear because I have my speaker notes and I have, so bear with me, please, as I find my way through this. So my topic, and Nita gave me a good segue, and it is about if you spend on military, then you disregard other things, and one of them is health. And my proposition today is to talk about the call, or to call for a standardized war health index, because as you will see from the following slides, there are many attempts to measure what are the effects of war on health, but we do not have one standardized index to do that, and that is important. And as we go through the slides, I will show why that is important. Okay, let me see if I can do this. All right, so as we can see here, and this is data from the Uppsala Conflict Data Program, and you can see that we have 160 deaths of violence resulting from violence in 2024. We have a rise in the state-based armed conflicts in 2024, and there are now 11 active wars. And here the definition of wars is wars that result in 1,000 deaths of civilians in a period of 1 year. So you can see that setting the stage for this is already very, very high statistics, and we need to do something about it. So the other complexity of counting is that now, with the use of IWIPA, explosive weapons in populated areas, the border or the conflict lines have become very, very blurred. So we have many civilians dying because, and I don't need to mention the many examples in the world of this happening at the moment. So we have 50% of fatalities in conflicts, in warfare, because of the warfare complexity. They cannot be defined, or what was the reason for their death. We also have restricted access when we want to get data in conflict zones because of the decline of infrastructure. Civil registrations break down, so we need to think a little bit out of the box as to how we are going to get this data. And then we have mixed violence types. I mean, the example of Haiti recently, where some foreign forces had to go into Haiti to control gang violence. We also have narco wars, which are going beyond just the traditional areas where narco wars were before. So does this call for a need to even redefine what is armed conflict? Because it's not the traditional armed conflict that we've been seeing before, which is state-based forces against civilians, or state-based forces against state-based forces. So we need to think a little bit how we're going to tackle this complexity of counting. Now, the other thing that is important to mention is the hidden death toll, and this is deaths of civilians, indirect deaths that happen because of armed conflicts. And I can see that, I mean, you will see that the statistics speak for themselves. This is based on a study that was done with data from 1990 to 1927. And it's a very interesting study. They used panel regression models, and they found that there were 29.4 million indirect civilian deaths from war, and you can see 21 million communicable diseases death and 6 6 million non-communicable diseases and injuries of 2.4 million. Another study that looked at counting or trying to count the burden of war. Again, this is a study from the, it's a working, let me check so I'm not talking just nonsense.
Global
sorry.
burden of disease. Global burden of disease.
Yes, they use data from the global burden of disease, but it's actually a working paper from the, again, the Uppsala Institute, Uppsala Data Conflict Program, and Oslo University. And so they use the global burden of disease data to measure the DALYs and to measure the effects of war beyond the actual conflict, the time of the conflicts, up to 8 years afterwards. And I'm sure I don't have to repeat the statistics because they speak for themselves. The other also attempt at measuring the effects of war on health and on civilian health is the 12D model. And this is done by a professor at the University of Colombo. And he has made a little bit more of a, let's say, a comprehensive model because it talks about the health determinants, which is the direct effects of war, but also social determinants and the environmental determinants, as we have seen Netta mention that. So what does that mean? It means that we really do need a standardized index for this because now we have 3 different models and they've done great work on this. And I'm sure that there's a lot of collaboration that can be done to move forward. And we are not starting from scratch because there are amazing data sets and databases that we can use for this that track what is happening in terms of conflict for civilians. So we can tap into all of this resources, and there is an opportunity for transformation because people are aware of it. There is a call for that. Many of these studies, they say that we need to measure and to know what is the impact of war on health because it is affecting people, as we have seen. And we can use it to transform things, and we need to have something standardized because that will help us measure what is the effect of war on health by standardization. We can use it to advocate because if we have clear data and we have a measurable data that can be compared among different conflicts and in conflicts themselves within different regions of these conflicts and different parts of a conflict, then we can advocate for more assistance and more help in that. And we can use it for lobbying and for forcing governments and other international organizations to direct aid as to where it is needed. And I am happy to engage further with you afterwards and in the Q&A session. Thank you very much.
Well, thanks, Osara, very much for giving us, I think, a great introduction into why we need better data on conflict and health. I'm now going to, I'm the next speaker. I'm Andrew Haines from the London School of Hygiene and Tropical Medicine from the Centre for Climate Change and Planetary Health. And what I'm going to do is to really try to drill down a bit more into the climate change, conflict and health linkages. We've already heard about one of them, which is that the military sector is a major contributor to greenhouse gas emissions, which, by the way, they don't have to declare under the UN FCCC, under the Framework Climate Change Convention. So some of those emissions are kind of concealed. So this slide really just shows us where we're going with climate change. And you can see that we're headed to unprecedentedly high temperatures. We have an increase of over 1.5 degrees in 2024. We're probably heading towards somewhere over 3 degrees global average temperature increase by the second half of the century. And that's a global average. So it's going to be increased in some parts of the world, it's going to be much more than that. And of course, it's going to particularly affect low-income populations who've had the least contribution to climate change and are the most vulnerable. But the whole of the world is being affected, and we can now increasingly document, we can attribute human health impacts to human-induced climate change. It's not due to natural variability. So let me move on a bit and just talk about the interlinkages. And the interlinkages between climate change and conflict are complex. So there may be multiple pathways. Obviously, militarism and conflict can affect the economy. They can cause high prices. They can cause volatile markets. They also destroy the environment locally, but can also disrupt supply chains, for example, food supply chains, other supply chains. They cause a lot of pollution of the air, of course, the the soil and water. And of course, in many cases, they also increase poverty and inequality, and they accelerate ethnic tensions. So you can see that there's a multiplicity of pathways by which climate change and other environmental changes can increase the risks of conflict. And this is an interesting paper by Solomon Siang and colleagues in Science 2013, which is a meta-analysis. So it's bringing together all the evidence from the studies that have been done since 1950. And what they showed was that there was a strong relationship a statistical relationship, between some climate indicators and a number of outcomes related to conflict. Local violence in parts of Africa, civil war incidents in sub-Saharan Africa, but also in the global tropics more generally. And this paper is an important paper, stimulated a lot of debate. So some social scientists said it was not really exploring the mechanisms, so it's just a statistical association. So there's a lot of debate as to how valid the associations were. And subsequently, there's been a lot of work by social scientists and others to try and explore the mechanisms by which climate change can impact on conflict risk. And this is just one example of those, again, using the Uppsala database. You can see in this particular study, they showed how drought, which is accelerated, of course, by climate change, can contribute to sustaining conflict, particularly for those groups that are dependent on agriculture and politically excluded, marginalized groups in very poor countries. And although we won't go into details, the slides just shows you that if you take a particular subsample with a high infant mortality, which is a marker of vulnerability, they had a particularly strong relationship between agricultural dependence and drought and the effects effects on conflict. So there are these complex interrelationships which mean that many of the countries that are vulnerable to climate change are also vulnerable to conflict, and there will be probably synergies between them. Another study suggests that countries where there's a lot of ethnic fractionalizations, where there's a lot of disparate ethnic groups, might be particularly vulnerable. So this particular country suggested about a quarter of the conflict outbreaks in ethnically highly diverse, highly fractionalized countries coincided with climatic calamities of one kind or another. And that's obviously because it accelerates the tension between different ethnic groups. If there are already inter-ethnic tensions or marginalized communities, then these climate disasters can amplify those tensions. It's also, I think, really important to understand that as well as increasing climate vulnerability, the conflict can impede adaptation, and it can do that in a number of ways. We know that hunger due to conflict has doubled in a recent 5-year period. And about 3/4 of acutely food insecure people live in fragile and conflict situations in states which are subject to fragility and conflict, often go hand in hand. And about 16 of those countries which are most vulnerable are fragile and conflict states. So they're most vulnerable according to this index, which is very widely used. And we also know that per capita adaptation funding is often lower in these fragile and conflict countries. So the funders often say, well, it's too difficult to adapt. Why should we spend our money in high-risk situations? But that may not be true. In fact, there is some evidence that you can still adapt, but you have to focus your adaptation strategies. So we should not abandon those countries. We should actually redouble our efforts. And this slide really exemplifies the point that Elsara made, which is that some vulnerable groups, their deaths from non-violent causes also increase during conflict. Because conflict doesn't just cause people to die from, explosive weapons or whatever. It also disrupts vital supply chains, it disrupts the healthcare system and so on. And this slide's taken from a series in The Lancet a couple of years ago, which showed that women's and children's mortality risk from non-violent causes increases substantially within 50 kilometers of conflict. So that's one of the explanations for the increase that you also showed. And the other point to make there is that there's an interaction with climate change, because we also know that infant mortality is something which can be affected by climate change. Children and women are particularly vulnerable to climate change in many circumstances. So again, there's potential for a double whammy, if you like, there. And so this all means that we also need a climate and conflict vulnerability index, which would, I think, really complement the point that you were making about better metrics. And our colleagues at PIC at the Potsdam Institute, particularly Barbara Sadova and others, are developing or have developed this harmonized set of data layers which allows us to maps risks by integrating climate and conflict hazards. So this is just one example of how researchers are trying to develop better evidence to map the vulnerability to climate and conflict as it overlaps. And then finally, we've heard from Nita already that rising military spending is diverting resources from meeting human needs. And I like this quote by a military leader, actually, Dwight Eisenhower. I won't read it out, but I think you can read it very clearly yourself. I think it's a powerful quote, actually, and it shows you how sometimes it's the military that actually understand the impacts of what they're doing. Not all military, sadly, but some do. And we've already heard this unprecedented rise in global military expenditure. And so let me just leave you with the thought that that $2.7 trillion is approximately equal to the amount of money that we need to be spending on climate action, climate mitigation and climate adaptation, which is about 2.4 trillion a year by 2030, something like that. So there's a kind of paradox there that the amount of money we're currently spending on destructive activities, if we could divert it, I'm not saying we can, it may not be very practical at the moment, but if we could, that would pretty well pay the cost of all the climate action that we need to do, mitigation and adaptation. So the idea that there's no money is a false one. It's just that we've chosen to spend the money in some other way. And the other point to make is the point I made earlier, which is we shouldn't abandon climate adaptation actions in very vulnerable countries. Because as this interesting review article a couple of years ago in Lancet Planetary Health said, even in conflict zones, the most effective climate adaptations focus on climate-centered technical solutions and poverty reduction. And importantly, they said that this has to be led by the community, because the community understands their local situation, their local vulnerability, and so on. So we must not abandon these communities. We must redouble the aid to them to help them to adapt as far as possible to climate change in these situations. So let me leave you with a final thought, with instead of conceiving security in solely military terms, what we need to do is to redefine security in the Anthropocene, the age that we're now living in which we, as humanity, not equitably, but inequitably, are disrupting the global environment. And so we need to frame that really as safeguarding health within the planetary boundaries of our small planet. And if we could do that successfully, I think we could reverse some of this trend towards militarization and actually start spending the money on what we really need to spend it on, which is safeguarding humanity from these multiple planetary crises. Thank you very much. So let me now introduce the next speaker, Carlos Umania, who's the co-president of the International Physicians for the Prevention of Nuclear War, based in Costa Rica and in Spain, both.
Yeah, thank you, Andy. Thank you. Hi, everyone. Yes, I'm based in both Madrid and San Jose, and I'm going to talk about the impact of nuclear weapons on human health. I have a lot to say, so if you blink, you might miss something, so don't blink. All right, so nuclear weapons are called weapons of mass destruction because they do not discriminate between military and civilian targets and cause a broad destruction. Other weapons in this category are biological weapons, chemical weapons, landmines, and cluster munitions. There are 9 countries that have nuclear weapons, according to the Federation of Atomic Scientists, which is the organization that basically counts how many nuclear weapons there probably are in the world. For this year, there's 12,241 approximately. And those of you who can squint your eyes and see a little bit at the map, we can see that the ones leading are Russia, followed by the United States. And the other countries, then followed by China, then the other countries have much smaller numbers. France, Great Britain, India, Pakistan, Israel, and North Korea. Those are the 9 nuclear weapon states, or somebody calls them affectionately the N9. And combined, these 9 countries spent last year, according to ICAN, the International Campaign to Abolish Nuclear Weapons, more than $100 billion just last year. And more than half of that was the United States. Now, here we're talking only about public money, taxpayer money that goes directly into nuclear weapons. If we're talking about like the money that goes into the companies that produce nuclear weapons, the number is much bigger than that. All right, so the destructive power of nuclear weapons is measured in kilotons or megatons. 1 kiloton of TNT, that is the destructive capacity that 1 ton of dynamite has. If we can see to the, far left, we can see that Hiroshima was about 15 kilotons. And if we can see to the bigger graph, that is very small compared to the destructive power of the most destructive weapons that have ever been detonated, which are megatons. That's millions of tons of TNT. That means that one single bomb is about 6,000 Hiroshimas. Just one bomb. Nuclear weapons have existed since 1945. They have been detonated in war twice in Hiroshima and Nagasaki. But there's been many, many more nuclear detonations. Approximately 2060, depending on the source. And the one country that has detonated the most is the United States. And they have been detonated in all of these areas, right? In the Pacific Islands, the Marshall Islands, the French Polynesia, Algeria, the Australian outback. Of course, there were people there. Of course, people had humanitarian impact from this. The common denominator here is that the people suffering this impact were all indigenous people, i.e. not rich, not white populations. Okay, so a nuclear blast, basically there's 3 forces that cause the humanitarian impact of nuclear weapons. The heat, the blast wave, and the radiation. The heat and the blast wave are common to also conventional weapons, right? Every bomb causes heat and a blast wave. But nuclear weapons are particular. Their effects last in space and time because of the radiation. So when we talk about the blast wave, we're talking about a wall of compressed air that causes hurricane winds that basically plummets everything and turns everything into rubble. When we talk about the heat at the core, at the hypocenter, we're talking about a temperature that is 6 times that of the core of the sun. It's almost impossible to comprehend by the human mind how hot that is. And at the surface, for instance, in Hiroshima, the detonation was 600 meters up in the air. At the surface, it was a temperature of hundreds to thousands of degrees centigrade. What this does is that it causes everything that is flammable to rise in flames, even to evaporate, and then to generate areas of coalescent fires. And these fires just come together and create large areas of fires that can constantly expand. What I'm showing you here is a nuclear shadow. That's the only thing that was left from a person that was close to ground zero. Now, when we talk about the radiation, this is important. We see the blast wave. The initial reaction is for the nuclear weapon to expand. And then because of the heat, everything contracts. So everything that was burnt, all the ashes, including the remnants of people, go back and form the typical form of the mushroom cloud. So all of these radioactive materials go back up into the air, into the atmosphere. So the radiation can be spread not only through the blast, but also through what is called radioactive fallout, which would expand downwind. Or if there's precipitation, it would actually also spread through the precipitation, what is called black rain. And radiation, what it causes is basically, at a glance, what it does is it harms the DNA. So it's going to affect the tissues, the organs, that have a faster rate of mitosis, a faster rate of multiplication. So we're going to have the acute radiation syndrome, which is going to happen at very high doses of radiation, doses that are higher than 70 rad, and they're going to affect mainly the gastrointestinal system, the circulatory system, the blood, and the nervous system. How does this translate in general? The survivors from Hiroshima and Nagasaki described horrible things. They described how some people's eyes fell out of their sockets, how their abdomens exploded, how they had wounds that would not heal, how their hair would fall out, and how they would bleed to death. There's also an intergenerational component here. The people who were exposed in utero would have very drastic malformations, such as the ones that we're seeing here. Now, as you may notice, some of these pictures are not that old. These are pictures that were taken from the survivors of the nuclear tests. So there's also the chronic radiation syndrome. The people who survived from the initial acute radiation syndrome would have not only the fibrosis of the connective tissue and the inflammation, but there's also cancers, several types of cancers, especially glandular cancers, such as thyroid, breast, but also a much higher rate of leukemia. And well, we can expand on this in the Q&A. There's so much to say about this. Right, so it's important to note that we are used to, that when there's a disaster, when there's a climate disaster, when something happens, that there is a first responder team there to attend the accident. In the case of nuclear weapons, that is impossible. Because, well, on the one hand, all the infrastructure is destroyed. We're not only talking about the roads, we're also talking about the hospitals, the healthcare professionals. Most of them would be either dead or severely compromised, as was the case in Hiroshima. But also because of the radiation, the high levels of radiation would preclude, first responders from entering into this. So what does this mean? This means that the people who are suffering from the acute radiation syndrome and from the injuries would actually have to suffer their agony alone, not only without any primary care at all, but also without any services, without any even basic services such as water. There's also an electromagnetic pulse, which is a burst of energy that happens with a nuclear weapon. Now, an EMP has a particularity that it is, its area is directly proportional to the altitude of the detonation. So even if the nuclear bomb that is detonated is not that powerful, if it is detonated at a high enough altitude, the EMP can cover a vast area, even the subcontinental north of the subcontinent in North America. So what does an EMP do? An EMP would destroy, would inhabilitate the power grids. It would basically cause a generalized malfunction of everything that is electronic. So we're talking about the lack of communications, anything, there's no internet, but not only just no internet, there's also no communications, there's no flights, there's no, everything that relies on electronics would fail because of the EMP. And then there's the survivors, the hibakusha, the people who suffer not only from the post-traumatic stress disorder, they would also be stigmatized because of the radiation syndrome. In Japan, people would not marry them because they would bear defective children. That was the fear. Or they would not hire them because they were prone to fall into diseases. And there was the associated stigma, aside from all the psychological and physical trauma that they were suffering. So there's also, this is one detonation. But when we're talking about a generalized nuclear war, we're not talking about one or two bombs. We're talking about many bombs, thousands of bombs over many cities. So aside from the tens of or dozens of millions of people who would die immediately and the hundreds of millions who would have injuries because of everything else we saw, there would be millions of tons of soot that would rise to the atmosphere. this suit would block the sunlight, and that would cause a drastic and sudden decrease in temperature, in global temperature. And it would cause what Neta was talking about, the nuclear winter. Now, this is a drastic decrease in temperature of about 10 to 15 degrees Celsius in average, but the numbers vary according to the scale of the conflict. And this would end in this would end in yes, thank you. So this would be existential, right? So this would be existential because there's very few ecosystems that could withstand this the lack of sunlight and the drastic conditions. Now, after the nuclear winter comes the nuclear summer, right? Because after this interaction would also deplete the ozone layer, cause a global spread, a global nuclear fallout, causing radiation to spread globally. And the living conditions during this extended nuclear summer that could be a relatively permanent condition would be very harsh. And I'm just going to leave it here. Just closing with this thought, there's so much to say here, but closing with this thought that the risk that Andy mentioned before, this is the Bulletin of Atomic Scientists doomsday clock. It's right now at minus 89 seconds to midnight. That's the highest risk in history. Now, this is the doomsday clock. I don't know if you've heard about it, the doomsday clock. It basically is a symbolic clock that measures or that indicates the risk of a nuclear war in minutes to midnight. It's not actual time. Over time, it's been, in 1963, during the Cuban Missile Crisis, it was at minus 12 minutes. In 1984, it was at minus 3 minutes, but when the Cold War ended, it was at minus 17 minutes. And today, it's at minus 89 seconds. That's the highest risk in history. And yeah, we can talk a little bit about, we're going to have a discussion about why that risk is so high, and why this is what nuclear policy looks like. This is what nuclear weapons do. Aside from this direct effect, nuclear policy, nuclear weapons were thought, a lot of people were very optimistic about the nuclear era because it would, the mutually assured destruction would actually make conventional wars obsolete. In reality, what happened was that nuclear weapons have emboldened aggressions, that they have poisoned the relations between countries and undermined security. So they have actually, endangered and created many more conflicts. So we must prevent what we cannot cure. Thank you very much.
Well, many thanks, Carlos. I mean, it's obviously very sobering, but very important that everyone understands the reality of the situation that we're living in, because otherwise we can't begin to implement or affect policy. But let's move on to hopefully a positive conclusion, which is about the way forward. And Neil, it's a great pleasure to ask you. Neil's from the Pegasus Institute, affiliated to the University of Waterloo and also McMaster University in Canada, talking about peace through health.
Yeah, thank you, Andy, and thank you, everybody. So like Carlos, I've got a lot of slides and a lot of things I want to say to teach a whole course in 10 minutes. We probably won't get through a lot. What I'd like to do is just describe a little bit about the connections between peace and health, a little bit about how health workers can make a difference and health perspective, so this concept of peace through health, and give you some examples. And if we have time, to tell you about some courses and a conference that our Pegasus Institute is going to have. So what is Peace Through Health? On the right is a book that I co-edited. So it's been described as an emerging, but it's been described as emerging for the last quarter century, academic discipline as to how health interventions or health personnel, health perspectives in actual and potential war zones can contribute to peace. And people at McMaster University, where I'm also associated, helped develop this concept. Interestingly, the WHO has taken an interest, and Chris Murray, who presented yesterday, talked about war by 2020, 20 years prior, being the 8th leading cause of death in the world. And unfortunately, I think WHO hasn't really, or the global burden of disease hasn't really systematically looked at that since. And I think Nita presented some stats, as did Elsara, which point to it still being close to that. There was a report on violence that they produced in 2002, which also hasn't occurred since. But one thing from that report in 2002 was this ecological model of violence, which I find very useful, looking at things at different levels: individual, interpersonal, community, and societal. And as we look at things in that way, as public health people, then we can think about prevention. Interestingly, the Institute for Multi-Track Diplomacy, which talks about other sectors, whether it be religious, journalists, judges, the legal system, does not include health as something that can help lead to peace. I wrote about this 20 years ago. We developed a working model, and we also developed a framework for education in medicine and public health sciences. And in that, I talked about connections between health and peace. And I think that the WHO and the UN Secretary General have said there cannot be health without peace or peace without health. But if we look more closely at the definitions, look at a positive definition, not just an absence. We look at this as being a human right with each. We look at determinants and ways of transforming. There are ways that we can approach both things simultaneously. And of course, if I had a whole lecture, I could have discussed that more. But I think, as Nita also talked about, we have to think about security differently. And security isn't just potential protection from physical harm, but also the access of resources to meet basic needs. And as Elsara said, that this is affected by the war machine. But there's also this illusory psychological dimension that causes us to increase spending, as you said, in response to the US. Johan Galtung, one of the great peace studies theorists, has talked about peace as being not just avoiding violence, but fulfilling basic needs. And those can be survival needs. Of course, if we don't have survival, we have death. But well-being needs, freedom needs, and identity needs. And war and violence are avoidable insults to these needs. And Galtung also looked at violence in terms of forms of violence. He's talked about the direct violence, so the acts where we know who the perpetrator is, we see the effects. It doesn't have to be physical injury, it can be psychological, social exclusion, spiritual, but we know who the perpetrator is and we see the effects. Secondly, there is what is called structural violence, the hidden processes. And so we know effects, or we'll see a decrease in life expectancy, but we won't know what the root causes are. The hidden inequalities in income, education, access to resources. And then there are the belief systems, the cultural violence that enables both direct and structural violence. And we can think also of ecological violence, as Andy talked about, the harm to the planet. So I think that we can derive these lessons from peace studies also in terms of health by this type of framing. We can look at the scale of destruction, and then with that, we can actually try to look at how to combat that. Combat using an unfortunate analogy. So Galtung also talks about negative peace and positive peace. So again, not just sticking with the absence of violence or fear of violence, but actually promoting something more positive. With peace through health, we talk about not just these effects that you can see, and oh, my pointer's not working, in the top right with war causing some of these, the structural violence and ecological violence, causing health deficits, and those things also predisposing to war. But peace through health is looking at how health workers, health perspectives, and health work can actually reduce both direct and structural violence. So to give you a few examples, and really briefly, so one of the first examples our McMaster people thought of was the formation of the Red Cross. But Henri Dunant, in 1859, witnessed one of the worst battles of the 19th century, the Battle of Solferino, and he was horrified. He went there to go on business, but in the end, he was so moved by things, he forgot about his business, and he went back to Switzerland and said, we've got to do something for the victims. And so that something was getting governments together and forming the Red Cross, the inverted Swiss flag. But he went beyond that. So he didn't just say, well, let's just treat people, but getting the governments together also to form the first of the Geneva Conventions. And since then, the rules of war have been regulated by these conventions. And Dunant won the first Nobel Peace Prize. After that, the Red Cross has won a few more times, and many health organizations have continued to do that. IPPNW, that Carlos has led, and I also was part of and am part of, has also studied things. But if you look at what Carlos said, he said there was no medical response. The doctors and nurses would all be dying in the inner cities. And back in the early 60s, IPPNW produced a report talking about the effects of a single bomb on Boston and what that would cause, and the fact that there was no meaningful medical response. This argument convinced people like Mikhail Gorbachev, and Gorbachev, together with an American, Evgeny Chazov and Bernard Lowen, who were Soviet and American cardiologists. They were friends. They formed this organization and said, well, we're trying to treat sudden cardiac death and prevent that, but our countries are bombing each other. And IPPNW took this medical response, the fact that there was no medical response, to spread this message that if you can't respond, then that shouldn't occur. Further, the fact that you could get people on opposite sides collaborating, this was considered to be quite unique at the time, and it turned it turned what was previously considered a military or political issue into a medical issue. Another example with humanitarian ceasefires, beginning in Central America, in El Salvador. Once again, I could go through a lot of details, but essentially they got the Duarte government and the FMLN rebels to agree to have a pause at Christmas time in 1985, something the two sides felt they couldn't agree on, and they had ceasefires 2 or 3 times a year, immunizing 200,000 to 300,000 kids each year, until peace accords were signed in 1992. And once again, we found that the two sides were able to find common goals. They were able to actually agree on something. This viewing child health as being predominant, actually, we believe, created conditions for peace. It was also successful as a health venture in terms of reducing infant mortality. And I think I'll just end here. I have a few more slides, and I can talk during the discussion about courses that we've done, and talk also about a conference that we have. But anyway, health interventions can help hopefully lead to peace. Thank you.
Well, thanks very much to all the panelists. And now really it's kind of over to you. So if you'd like to ask a question, put your hand up and just say what your name and who you're addressing the question to. Thank you.
Yeah, addressing to all speakers because, yeah, that would take too long. Maybe to start, I am the Director Global Projects and Disaster Health and Conflict Medicine Training at Lecturio, and I attend during the last 2 weeks 4 different conferences in combat medicine, conflict medicine, military medicine. Now I'm changing to the humanitarian health. But the question that I want to ask in terms of the nuclear situation and also in terms of public health is, it's not about the big nuclear war. What about if a country that is owning nuclear weapons will use a drone with a small tactical nuke, which is less than 1 kiloton, and it would approach on their own territory, but to the border of potential enemies, just to test out the reaction, just to test out what is the maritime ship traffic, how the public health system will react, how the military forces will react, and that will extend to a large-scale conflict, ongoing conflict. Then we are counting up to 10 kilo casualties per day. And the question is in terms of the logistic, because on the one side, on the front line, we will have the military medicine, but they are depending on public health. Okay. Public health is totally fragmented.
Right.
And the backbones will go over the complete community of countries. So how do you react? How do you see this potential threat currently?
Okay. Carlos, do you want to start off with that one?
Yeah, but I was going to say perhaps we can take a couple of questions and then
okay.
answer like
okay, there's plenty of other hands up, so remember that one. And yeah.
Hello, my name is
Yep, go for it.
my name is Chris Knaut. I am from the Deutsche Plattform für globale Gesundheit. My question is to Nita. You have presented military spending as a major issue, and this is without doubt a government function. But what is the role of the private sector and private actors in conflict? I mean, we remember the Iraq war was done by military contractors. We see that Elon Musk has now more satellites in space than governments of US and Russia. So what is the role of private sector and non-state actors in deciding about war and peace, and how much are they part of the problem?
Great. Okay, great. Now, there were some questions here. I'll tell you what, we're going to take 4 questions. Oh, I was going to take, sorry. I'm going to come to you later. Let me take these 2, and then we're going to take 4 questions. One more, okay. Go.
Hello, I'm Dersim Dadiren from the Germany-based network of Kurdish academics. And when we talk about conflict, we talk also about, or we have to talk about conflict resolution. There are some resolution processes. For example, now in Turkey, a dialogue process started between the Turkish state and the PKK. So what about implementing monitoring bodies from the physicians or the healthcare sector to monitor these processes?
Great. Okay, another quick question here at the back. Sorry, I know there's lots of hands up, but
thank you. Here is Ola Erdwan from International Pharmaceutical Student Federation. Actually, my question to Neil. You say there is no health without peace. In Gaza, people are losing both peace and health. So what real actions can a WHO or other organization take to protect civilians and rebuild the health system again? Yeah. Thank you.
Good, okay. I'm aware you've got other hands up. We're going to come to you in a minute. I'll come to you next, okay? And I'll come.
So yeah, very quickly, I'll try, I promise. So what you're referring to is a nuclear taboo, right? That there's this idea that what's preventing anybody from using nuclear weapons is that everybody knows how awful they are. Nuclear weapons, in general, they don't respect borders. They're not made to, even the quote-unquote small nuclear weapons, you can't control their effects. You cannot limit. They're not made to target military targets, but to cause a greater destruction. So in that sense, when we talk about tactical nuclear weapons, that's an oxymoron. There's really, when we talk about something tactical, is against a military objective. How nuclear weapons are being used is, the rhetorical threat, what is called nuclear deterrence, the threat of use of nuclear weapons. So how they are used is, like this is there's a cognitive dissonance in this threat. And we have seen it a lot since 2022 when with the invasion of Russia of Ukraine. Many people said, okay, Putin would not cause a nuclear war, would not use a nuclear weapon because that would be crazy. However, the threat of nuclear deterrence relies on a credible threat that he will use nuclear weapons. And the closer we get, as you pointed out, even with the quote-unquote small nuclear weapons, as there is no such thing as a small nuclear weapon, would lead to an escalation that leads to a nuclear war. There's been many scenarios that have been carried out, and they all end in the same way. And when we were talking about the very high risk that we have right now, part of that high risk is the emerging technologies, AI. And the risk that AI has with nuclear weapons is how it, number one, reduces human agency when it comes to these decisions that have to be made in minutes, because a nuclear war lasts minutes, not years or months or days, but minutes. And number two, because the speed of the decision is a lot higher. So there's something called algorithmic deterrence, and that's what AI. So anyway, that's the nuclear taboo that is becoming ever more fragile as the world becomes more fragmented and as these emerging technologies become more uncontrollable.
So we go around, Nita, do you want to? Next, yeah.
Okay, on contractors. I think we have to distinguish between military contractors who are performing services and those who provide stuff, material. Military contractors who are providing services to militaries are on the payroll, so they're part of the budget, and they're an increasing part of the budget of big countries. They also are very highly greenhouse gas intensive because military production in general is capital and intensive and material intensive, requires a lot of energy because of the high tolerances that most military equipment has to meet. Okay, so they have a tremendous amount of power in terms of, in a country like the US, they fund the campaigns of many members of Congress, and then many members of Congress, and I've sat in their offices, will say that they cannot decrease military spending because it will hurt jobs. Now, the argument there is actually not right. It actually costs jobs. You get more jobs, let's say in healthcare or education or in transportation, when you spend it on something else. And then I want to just say about Gaza, the physical violence has led to the structural violence that we're going to see play out for decades. And we saw this in Afghanistan and in Iraq. The war is not over. When it's over, it will continue. The Geneva Declaration Secretariat did a study, an analysis, where they said that it's between 2 and 15 times the number of people die from indirect causes, that is the destruction of infrastructure, healthcare, vaccination, lack of medical personnel who fled the region. This is not only the fast destruction of a people, but it is I think what we're going to see is decades of reverberating effects.
Sarah, do you want to? Anyone you want, yeah.
So just regarding the idea of having health workers monitor the peace, many years ago I was working in Sudan in the conflict resolution program, and we did with UNDP, and we did many meetings between the conflicting parties on development issues, and one of them was health. And as Neil had mentioned earlier, that this sometimes leads to a cessation of hostilities, so that people can go in and do vaccination programs or do some baseline survey collections, data collection. I think it's an excellent idea. However, it might be needed to be drafted into these agreements when they are done, because, again, we cannot have peace without health, and because of the many reasons that Nita and Neil have mentioned. So in principle, I think it is a good idea, but we need to find ways and modalities to have it included in these agreements when they are first done.
Neil.
Yeah, a complex question, and I'll try to deal with it a little bit indirectly. The first thing I should say is that there can't be peace without justice also. And I actually haven't said this publicly or even privately, that there was a genocide. I have to agree with Amnesty International, Human Rights Watch, Beth Salem, Physicians for Human Rights Israel, and genocide scholars. And sometimes solidarity is important, and certainly dissemination of facts when I look at mechanisms of peace through health. So I think one of the things that's powerful about the health sector is it's the last thing left lying. You have to have a health sector that you can build on with a society. Health gives hope. And so I do think that health organizations, international, national, regional, are going to be important in terms of rebuilding Gaza. Our organization is trying to work with WHO EMRO, that Ali Ardalan is the doctor in charge of the reconstruction phase in Gaza. And I think that the needs are so great. I think you have to start with the very basic needs of people first. And before you look at mental health, you have to get people food, get people housing, get people education. So work on health, but not necessarily health sector type people. And then you work on those other things. And then sometimes when you get people together, that can be a peace building exercise. And I hope that we are really allowed to do that. I know people are hopeful on all sides. And I spoke in Israel, in Beersheba, to people at Ben Gurion University after Operation Cast Lead in 2009. And there was, underneath everything, underneath what we might see as being hate on each side, distrust, there is still a common humanity amongst many. And I think that that's something that we're going to have to build on, and the health sector will have a role in that. Thanks.
Thank you. Great. So I think you're first, and then we'll move around.
Hello. Thank you for a really interesting session and a very important session. I think we're all in this building because we care about health, and more importantly that we care about health worldwide and global health. And we've learned today that conflict has a very important part in health and a very big impact on health. In fact, everybody outside has also learned that because it's the 8th leading cause of death, as you said before. So my question is how do we get this topic of conversation from this room and onto the keynote stage and onto the big stage in front of everybody? Because we were just discussing amongst us, and this is the first time we've heard people talk about the conflict in health, violence in health, and say the words of Gaza and Sudan and say the word genocide. And so how do we get this onto the main stage?
Great. Okay, we'll come back to that in just a minute. Very important. Yes.
And again, thanks very much for a wonderful and vital conversation. Off-ramps and the political incentives to actually adopt them in this environment where the drivers, I would argue, is actually to acquire nuclear weapons. If you've got them, like North Korea, you're not going to be invaded. If you give them up, like Ukraine, you're invaded. And with the hypersonic delivery mechanisms that we have now that are stealth, it's really difficult, as we all know, to be able to protect yourself. Mm-hmm. So in this fractured moment, how do we actually, what are the off-ramps to get that clock down? And what are the political incentives and mechanisms to have those off-ramps adopted? Thanks so much.
Thank you. Great question. Another great question. We'll come around to yes, to you, sir.
Thank you very much. I'm Jacopo Tomasina, Advocacy Manager for Emergency, which is an NGO who provides mostly surgical care in conflict zones. So we witness directly many of the things that has been said today. I do completely agree about the fact of the indirect effects, because unfortunately in the last decade we saw how attacking civil infrastructure and especially healthcare infrastructure is becoming the new normal, with ripple effects that will be witnessed for years, and we don't know yet how much this will affect. Actually, part of my question was already done, but I will just elaborate a little bit more. Because, maybe it's a little bit naive, but good brainstorming can help here. We often speak among ourselves, and a lot of us do amazing advocacy work outside, but it looks like we're speaking to death. There is military expenditure on the rise, while ODA is declining, while health expenditures are declining, so money is there. It's just that there's a political will to direct money in these other sectors. And even if many of us are into the advocacy work towards our governments, towards international institution, it looks like, as of today, we hadn't found an argument that can really work to try to switch these momentum that we're witnessing. So it's for all the panelists, but also for the rest of the people in the room, what can work? Do you have any best practices? You witness something that worked in your daily routine of advocating for these kind of things? Please share, because we really have to come together and to join forces. Thank you.
Okay, another great question. So we're just going to move around and we're going to take last two. I think that's all we've got time for.
Right. So when we think about health and military and wars, well, what I think is that war is a direct conflict to health, because essentially war is a kind of elimination of life, which is what health represents. And right now, when we see a lot of new technologies, not only nuclear weapons, drone warfare, but also, for example, companies like Palantir, who have AI warfares in these, I feel like this is like an armed race between how we can save more lives and at the same time preserve the same lives. Yeah. So what's the thought on that kind of race to the bottom, or perhaps is there a way out?
Okay, thanks. All very pertinent, very difficult questions. Carry on, yeah.
Thanks very much to the panel. My name's Harry Coleman. I'm an advisor in health system strengthening at the KIT Institute, and I also coordinate our Centre for Health Systems in Fragile and Conflict-Affected Settings. My question is probably mostly for Neil, and it's a bit linked to some other points I think made in the room, but it's really about the role of politics and politics through peace or peace through health, because there's been several global initiatives such as the Grand Bargain or the New Way of Working, and now translated to health, the WHO Global Health for Peace Initiative, which is trying to integrate so-called conflict-sensitive practices and programming in the work of multilateral agencies, but also NGOs working in conflict settings such as Gaza and Sudan. But it doesn't seem to at least have worked in the short term. So I wonder if there is if we need to be taking more political action as people working in the health sector, or be better advocates in order to change the situations in these contexts.
Great. Well, thank you all. Really great questions, and I'm sure the panel will deliberate on them and try to summarize their answers in a few minutes. But how do you want to go around? Should we just go around and I'll sort of conclude maybe? Yeah.
Sure. Thanks, Harry, and the others for those questions. I think that we have to center things on health, and it's nice that we've gathered together here with people from governments, people who can implement change, and people who see health as being central. I guess one thing that I've quoted in my talks quite often is Rudolf Virchow, and Politik ist weiter nichts als Medizin im Großen, that politics is nothing more than medicine on a grand scale. And Virchow saw that, I guess it was now with my math, more than 170 years ago, studying coal mine workers in Upper Silesia. And I think that we have to look at this 8th leading cause of death and put more into investigation too. So that's one thing we haven't really talked about so much, furthering the study, and hopefully we'll look at that, teaching about this more. and I think we will be able to influence people. There's another thing in terms of trying to put it all together in terms of environment development or humanitarian development, peace types of things. I think we have to look at health and peace in all policies. There's a health in all policies initiative that certain governments have taken, and so I think we have to work on that. Some of our work talks about mechanisms of peace through health, and I'm happy to talk to you about that afterwards. I think that's really all I can say. Whether people want to receive this message and change, whether they're able to at this time or more of a crisis is required, I don't know.
Yeah, regarding the doomsday clock, in 1991, the doomsday clock, let's remember, was minus 17 minutes. That's when the Cold War ended. And that was the key point, many thought, that would lead to nuclear disarmament. Actually, a lot of the very strong activism in the 80s, those who were around there remember that the 80s was a very strong era for anti-nuclear activism. Everybody thought that when the Cold War ended, that nuclear weapons would disappear, but they didn't. And why didn't they disappear? Because nuclear weapons had become a status symbol, and because there was a reason for the countries that had nuclear weapons to keep them around. And that reason did not disappear when the two main powers lost their main reason to fight each other. So the world became increasingly multipolar, etc., and now we've ended up in the situation that we are right now. But having peace is not the absence of war. Peace is not the absence of conflict. Peace implies the nonviolent resolution of conflict. And this implies diplomacy. This implies creating opportunities for cooperation. It implies bridge building. It implies removing othering. There was this author who talked about this idea about a fairy tale curse. She mentioned that some people who had lived in conflicting zones that were mortal enemies, that they were able to sit down and have a beer simply because their circumstances had changed. And they were able to see the humanity in each other. Right, so she described that as kind of like a lifting of a fairy tale curse, where a curse that actually took that humanity away. So peace is that. Peace is removing the curse of othering. So we don't need a deterrence. Peace is not built through deterrence. When we talk about why Ukraine was invaded, for instance, because it gave up its nuclear weapons. There's other countries that have given up their nuclear weapons. For instance, Ukraine, Belarus, and Kazakhstan, they were former Soviet countries. They gave up their nuclear weapons that were not really theirs. They were controlled by Moscow. But also South Africa gave up its nuclear weapons, and it has not been attacked. Ukraine was attacked not because it gave up its nuclear weapons, but because Russia kept theirs. And that's what nuclear weapons do, right? They embolden aggression, they undermine global security, and they poison relations between countries. So, yeah, peace is changing the narrative, and that's what we're doing. There's currently 99 countries that are supporting the Treaty on the Prohibition of Nuclear Weapons. That is a majority of the international community. 99 countries that are against nuclear weapons, that are against relying on nuclear weapons as security. Pretty much how biological weapons and chemical weapons became taboo. Pretty much how there's no country right now that claims to be a chemical weapons power or that has biological weapons in its security doctrines. That's what is currently happening with nuclear weapons. And that's how we'll get there, with normative change. Again, nuclear weapons are not a natural disaster. They are a political crisis, and it's something that we just can solve together.
Oh, one quick thing, one sentence.
Let me just bring in, because we haven't much time, so I want to bring in Anita and Sarah.
So I'll answer the question about off-ramps. I think I've identified probably 6 important things to do. The first of them is that democracy is antipodal to war. Anything that we can do to increase accountability, responsiveness, transparency, participation is important in every institution that we're in, because democracy says you take force off the table, okay? And that might sound Habermasian, Frankfurt School, but it's essential. That's the foundation of peace, is taking force off the table and saying we're going to resolve our conflicts peacefully, which gets to political incentives, in the sense that if we can mobilize movements in our patch, whatever our patch is, we change the political balance of power. And then the next thing I think is important is to get at these beliefs, which are an incentive to arm, to be bellicose. And some of these beliefs, like the conflict climate change nexus, need to be problematized. Okay, and so if we have increased government capacity in places, what we see is that climate change doesn't necessarily lead to conflict. Okay, but it can. All right, so what we have to do is make help countries which are more vulnerable to be more resilient and to adapt, and also do our part when we can to reduce emissions. Next thing. We need to take a longer view. A lot of what we have in our politics is a sort of either a focus on the immediate or this sort of distant future. What we need the long view, and that is a long view with attention to costs and consequences of what we do in the now to make ourselves feel secure in this moment. Last, and very important, is to decouple nuclear weapons from conventional doctrines. The conventional doctrines that India and Pakistan have, for example, will call for the resort to nuclear war. The same with Russia, the same with the United States. We have a very tight connection between offensively oriented conventional doctrines, and those doctrines can lead us to nuclear war. And the way to do that, to decouple that, is to have conventional military doctrines which are not so offensively deep strike oriented, but which are more defensively oriented. And by the way, defensive defense or non-offensive defense was born in Germany as an idea. That, that you can have doctrines which are not so threatening to an adversary, and that's how you ratchet down the tensions. And ratcheting down the tensions and ending ongoing wars is how we make change. This is an off-ramp. So you end the Israel-Palestine conflict by the two-state solution and many other things. You end the long war between North and South Korea, demilitarize. That will decrease the need for Japan to increase its military spending. You deal with the China-Taiwan conflict, and I'm blinded by the light, but I know you want me to stop. And then finally, you work on India-Pakistan. All of this is essential, this reduction of tensions through gradual peace building, confidence building, changing military doctrines. It's a lot of work, and it has to happen.
Just the last few seconds of...
Just very quickly, regarding the advocacy, I think this is why I made a pitch to have a standardized index, because if we're all speaking the same language, that could maybe, the idea or the theory of change is that this will help us to all speak the same language and present the same evidence, and that can help with advocacy at different levels, whether it's at the international, governmental, or international organizations. Quickly, regarding the peace initiative, I think we can have peace through health, because when there is war, and a case of Sudan that I know of personally, is that they have changed, the organization had changed their way of engaging and the way of delivering services. Before it was just providing health materials, and now they have change to engaging with local communities, building the capacities of local communities. And now people are aware that they can do things themselves, and they have been very ingenious and very inventive in delivering their services. So this is a hope. This is a way that we can move forward. And this is the idea of having peace through health. Thank you.
Andy, just one word, humility. Because when I talked about things, I want health workers to listen, to use other non-health people, artists, teachers, and also to be educating ourselves, to be using the voices of people from the global south and amplifying those voices from zones of conflict. So I apologize for not saying that earlier.
That's great. Well, look, unfortunately, we have to stop now, but can I just sort of throw back the challenge to you in the audience? Because, you know, you're all influential people. You have your own networks. So I think we should think about this as a kind of beginning of a kind of movement building, if you like, towards a much stronger voice from health about the need for peace. So I would throw the challenge back to you and say, go back to your networks, try to amplify these ideas, develop your own interventions and actions, and then hopefully we can meet perhaps in a year's time with an even bigger group and with some positive momentum. Thank you all very much indeed. Thank you.